o'clock, December 23rd, 1940. Before Pearl Harbor, before building of the Scioto Ordnance Plant, before Marion Engineer Depot, before Marion launched on a program of rebirth and rebuilding. This was and is the voice of WMRN.
Good morning. This is Joe Ione welcoming you to Marion's favorite program, Between You and Me, hosted by Scott Spears. This morning, we will discuss people, places, and plans, and, if we're lucky, you'll be informed, educated, and entertained. And now, without further ado, call the neighbors, wake the children. Here's your host, Scott Spears.
And good morning, good morning, good morning. Scott Spears along with you on this Saturday, February the 26th, 2011. 23 degrees here in Marion, 7:10 in the a.m., and you're tuned into Between You and Me. Going to have a fun hour this hour. We're going to talk with Dr. Scott Gray about his new book, Good Back, Bad Back, the 10 Things Women Must Know to Eliminate Back Pain and Look and Feel Younger. Should be a great conversation because a lot of people suffer from back ailments, and certainly women, and we'll talk with Dr. Gray about that in just a few moments. Did want to thank one of our longtime listeners for sending me a birthday card this week. Just a great lady. Should I mention her name on the air? I might as well. Barb. Barb, you know who you are, and thank you so much for sending me the Barb Fleming. I'll say the whole name. Thank you for sending me the birthday card. I certainly appreciate that. You're a good friend and just a pal. Did want to let everybody know that this coming Thursday from 7 to 9 p.m. I will be out at OSUM March the 3rd, this Thursday, signing copies of a new book, To Madge with Love, the story of Marion's First Lady of Broadcasting, Madge Cooper Guthrie. The book is $17 if you'd like to purchase that or just come out and enjoy. I'll be there along with a lot of other people who contributed to the book. So that's Thursday night, March the 3rd, 7 to 9 p.m., OSUM, no admission. Hope to see you there. We're going to take a quick commercial break, come back with Dr. Scott Gray right after this. This is Scott Spears, and Dr. Scott Gray has written a new book, Good Back, Bad Back, the 10 Things Women Must Know to Eliminate Back Pain and Look and Feel Younger. Joining us in the studio this morning, Dr. Scott Gray. Thank you so much for coming in this morning, Doctor.
Thank you, Scott. I appreciate you having me here. And not to get off track here, but I just want to say congratulations to you as well with your new book.
A couple of authors sitting around talking.
A couple of Scots, a couple of authors.
That's right. It all works together. It's a lot of fun to write a book, isn't it?
It is. It was a very interesting experience. It was fun to work with the publishing company that I worked with and just really experience that. I mean, it's a big endeavor to go through, writing a book, but they had some great editors. I got to work with some editors from Self Magazine, Women's Health, Men's Health, that really understand how to, put something together like this.
Now, what was the evolution of this book? How did it come about?
Well, basically this came out of, I think, some frustration of mine just in trying to get information to my patients and really take the time to educate them on what it takes to prevent back problems from happening. And so what I did is I put together everything that I know on back pain. I mean, this is, the day-to-day things that women go through, from getting up in the morning, putting makeup on, to getting ready, doing their hair, all the different things that they go through throughout the day that will maybe cause them to have some sort of back pain or arthritis or something in their lifetime. And these are just simple things that they can do each day to prevent serious problems from happening. So, this is really my collection of knowledge on what it takes to prevent back pain. And, I feel like the dentists have done a good job of educating us on how to prevent problems with our teeth. And, every day we brush our teeth 2 times, 3 times a day to make sure that we prevent problems down the road. But a lot of us don't know how to take care of our back to prevent problems. That's what this book is all about.
Now, why women?
Specifically women, I wanted to start there. I'll be doing some for men and other, probably children as well. But I started with women just because in my practice, I actually have, you go to any chiropractor's office, there's more women in a chiropractor's office because I think, women act on their health ailments a little bit more than men do. So we definitely see more women in that case. And so, I just see more women trying to do things about their back pain. So I figured that was a good place to start.
I would think it would be just the opposite. I think you think of men lifting heavy things and women maybe not. Maybe that's a misconception. But do you think men have less back pain or they're just not reporting it?
I feel like they just don't report it as much, or, we try to brush it off. We try to act tough. We try to act like we can get through it. Oh, this is just going to go away. And those are dangerous words to say that this is just going to go away. Typically, when I see men, they're in very serious back pain. They wait too long to deal with it. So, back pain's like anything else. The earlier you deal with it, the easier it is to fix it. And, guys do wait a long time. So typically when I see men, it takes even more to help get them back to where they want to be and to be able to work and do the things that they want to enjoy life.
Now, when somebody comes into your office, do you say, what have you done? How have you hurt your back?
Definitely. We really want to find out exactly what's happening, what they've done, find out what they do at work, find out what they do on a regular basis. Our lifestyle determines a lot of how our what we call a mechanism of injury, or how we injure our backs. So I definitely search to find out what that is, try to answer any questions that the patient has. Then we do a complete orthopedic and neurologic evaluation on the patient to find out exactly what's causing the problem. And once we do that, we may need to get some x-rays, and we can do x-rays right there on site, and we get those and find out exactly why they're having back pain. And then what I typically will do is just go over those x-rays with the patient, go over what's ailing the patient, why they have back pain, and if it's something that we can't help, we'll refer them out. If it's something we can help, we can tell them what we can do, or if it's just some simple at-home things that they can do, we'll tell them how to do those as well.
I think most people would think orthopedic, we understand that. Why neurologic?
Neurologic because back pain, headaches, neck pain can be more serious things. We have to make sure that there's no lesions in the brain, lesions in the spinal cord, especially if they're having problems out into the arms, hands, fingers, if they're having nausea, dizziness. These could be more serious problems. So we have to check all the nerves, the cranial nerves, to make sure it's not something more serious. And that's, a lot of people, they'll get headaches and they'll just take medication to cover them up. Headaches are not normal, and headaches could be a sign of something more serious. And it's very important. If you're having headaches, back pain, get them checked out by a trained professional. You need to go through these tests just to make sure that you're okay.
Now, everybody out there's had a headache, I'm sure. I've had a headache. We've all had headaches. Now, when you make a statement like that, I think people get nervous because we've all had them.
Yes.
We're saying, boy, that was a terrible headache. My goodness, what could that have been?
Right.
What's typically the cause of a headache? Is there a typical cause?
I would say the most common, obviously stress is a big effect, because when we have stress, a lot of us carry our stress in our neck and our shoulders. So what it'll do is it'll tighten up our muscles, which can cause misalignments in the bones. We end up with tension headaches, and that's where we get all that tension in the back of the head, and it'll start to creep up the back of the head over the top or up over the side, over one ear, the other, or both sides. That's probably the most common that I see in my office. Then there's obviously sinus problems. As we go through the winter months and we have all these changes in the weather, people end up with sinus headaches, and we're actually able to help with those as well. But sinus, migraines, and tension headaches are the three most common that we see.
I always like to ask this when somebody writes a book, Good Back, Bad Back, the 10 Things Women Must Know to Eliminate Back Pain and Look and Feel Younger. That's pretty self-explanatory, but how'd you come up with the title? Who decided that was going to be the title?
That actually my patients did. What I did is I came up with a bunch of different titles, and obviously since it was for women, I listed about 5 or 6 titles and gave them to my patients and said, what would you like to read a book about? And I say overwhelmingly about 80 to 90% picked this title. I can't even remember what the other ones were, but they didn't fare too well in that survey, and that's how I named the book.
So did you come up with the titles yourself?
Yes, I did.
Oh, now are you satisfied with this title?
Oh yeah, I love it. I think this is really what it's all about. I want to help people eliminate their pain. Okay, I think this book helps people do that, to look and feel younger. A lot of people don't realize that when you have aches and pains, it puts us in a certain posture. It makes us look older. We talk about osteoporosis as well, which, we can get that, what's called the Dowinger's hump. And, that's something that I think a lot of women fear because they worry about osteoporosis and worry about the fact that, you can start to get that hump later on in life. We talk about that. We talk about how you can, become a more erect posture so that you look younger and feeling younger. When you have back pain, when you have neck pain, when you have headaches, you don't feel good. You can't do things in life that you want to. Life's about having fun, playing with the kids, playing with the grandkids, going on vacations, enjoying yourself. And when you're in pain, it stresses your relationships. It may make it hard to go to work every day. All those different things. This is designed to make people feel younger.
So if, obviously this is not a novel, what is this? Is this something you want to keep in your house? Is this something you want to refer back to? Is this something when you first get it, you'll just want to read it all the way through? Or is it all the above?
It's all the above. I recommend, I've made it short. I've made it very concise. I took a lot of editing to get it to exactly what I want. People can read through this in about an hour to an hour and a half. So read through it the first time, get a general knowledge of what you need to do. Then you just refer back to it when you want to look at some stretches and exercises and things that you should do on a regular basis. I mean, really simple things that would take you 5 or 10 minutes a day, just to prevent problems from happening. Just like we take time to brush our teeth, take time to do some stretches and some exercises. So something you can refer back to. And if you get in a car accident, if you get in a work injury, if you have some kind of injury to your back, all that stuff's in here too. So there's a lot of information that you can use at specific times or just on a general basis as well.
What are the statistics of people in the United States that will suffer back pain?
Well, the statistics for low back pain is that 85% of Americans will have low back pain at some point in their life, so almost 9 out of 10 people. With neck pain, it's about 1 out of 3.
I'm a lucky person. I've never had it yet. And I say yet because so many people do have it. Mm-hmm. How would I continue not to have it?
The best thing to do is to make sure that you do get your spine checked by a trained professional. I encourage everyone at least to get screened to make sure that they don't have any kind of curvatures or anything in their back that may be causing early degeneration. I go around to the schools and do scoliosis checks for many of the schools around this area to make sure that kids their spines are growing straight up and down. This is something that can start very early on in life. It's important to have your kids checked. My brother's a chiropractor as well, and he's got 4 kids now, and when his kids were born, he adjusted them right when they came out. So we adjust babies even. Obviously, when you think about a chiropractic adjustment, people may think of something, forceful or, but it's not with babies at all. It's very, very light treatments and adjustments that we do because birth trauma is very, very traumatic. I mean, look at the birth trauma of a baby coming out of the birth canal. There can be yanking, pulling, suction cups, forceps, all kinds of different things that they use to get that baby out. And that can cause some trauma to the neck. So we check those things. A lot of our patients bring in their babies, and we'll help their babies with colic problems. It'll help their babies with, acid reflux and all kinds of different issues that you would never think would come just from problems in the spine. And, this book explains how all of that happens so people can really understand the types of problems that we can get from a back issue. A lot of times people don't realize what back problems can cause, but to prevent problems, make sure you're getting your spine checked, make sure you know what it looks like. I tell people that if our spine was on our face, we'd take better care of it. If we knew what it looked like, if we knew what was going on in there, most of us don't know. So you need to get that checked. After that, doing some stretches and some exercises. We've heard a lot about doing core workouts. Core workouts are very, very important to make sure that your core is strong because that stabilizes your spine. And if you have a weak core, you definitely can get degeneration easier. Your spine can just go downhill a lot easier and a lot quicker without a strong back.